Migraine treatment success secret number 10, thyroid binding globulin. When thyroid hormones are secreted from your thyroid gland, they're bound to a carrier, or protein. This protein is called thyroxine binding globulin, or TBG. So TBG is similar to a taxi cab, and your thyroid hormones T4 and T3 get into the cab, and they're transported to the liver where they're converted. Then they jump back into the cab and they're transported to the rest of the body and used. The fact is that there are so many of these little taxi cabs or carrier proteins called TBGs that the normal free amount of T4 and T3 that should be floating around isn't. It's as if they get all sucked up by this big sponge by all these little taxi cabs, which are thyroid binding globulins. Here's the thing. Your TSH will look normal, your total T4 will look normal, your total T3 will look normal. If that's all the markers your doctor's checking, then the problem's completely missed. This is why you need all of the thyroid testing done, just not the TSH, T3, and T4. You need resin T3 uptake, free thyroxine index, free T3, thyroid antibodies, in addition to the ones named above. If your TBG is too high, even though your TSH is normal, and T4 looks normal, and total T3 looks normal, your doctor needs to check your T3 uptake. It will show that actually the T3 uptake is low when the thyroid binding globulin, or TBGs, are high. Remember that the lab reference range of T3 uptake is extremely broad, where the optimum or functional range is much narrower. Estrogens, a hormone hanging in the body, eliminates TBG also. Birth control pills contain estrogen. Some facial creams and cosmetics contain undisclosed estrogens, and these estrogens can elevate in the body and they're detoxified through the liver. If you have poor liver function or inability to detoxify, this is yet another reason you could still have thyroid type symptoms. It's not necessarily a thyroid gland problem, but it's more of a liver issue. It's important to realize that there are many more causes of your thyroid dysfunction and your headaches, more than just my TSH is low. Again, we want to do all the testing into the root of the problem, what's happening with the patient. If thyroid binding globulin, TBG, you could have a low thyroid symptoms but normal lab numbers even though you're taking medications. Give our office a call. I look forward to helping you.